The first couple of slides are some things that I put down as a developmental pediatrician that I think can be helpful. Monica, I didn't know if you wanted to talk about those slides or if you want me to touch on those, because I think the really important stuff is what the parents have to suggest.
Yeah, Amanda, if you want to run through them and then I'll take over.
No problem. Okay, so if you want to go to the next slide. So these are disclosures. This is just something that we need to let people know. I do research in autism spectrum disorder, and some of these organizations have provided money to CHOP for me to contribute to some of the research that I've done. My husband does work for a pharmaceutical company. We're not talking about medications today, so none of this is going to really be relevant. Next slide. So I think it's helpful to think about, I know families often will have questions when they come to see me, and I kind of think of it as like all the WH questions, right? Well, who can make a diagnosis? What's going to happen? What tests are going to be done? How many times am I going to need to come? How long is the visit going to take? There's all these things that I think a lot of families are wondering as they're preparing to come and see someone like myself or to have their child evaluated. And that can create a lot of anxiety. So the goal of this talk is to help people be a little bit less anxious and feel a little more prepared. Next slide. So first, who can diagnose ASD? It's often going to be a physician or a nurse practitioner or a mental health professional, but that could be a primary care provider who's had some specific training around how to make that diagnosis. It might be a specialist like a developmental pediatrician, a neurologist, or a psychiatrist. In the mental health side of things, there's also clinical psychologists and school psychologists that can identify these characteristics and make that diagnosis, and a licensed clinical social worker can do that as well. Next. And I think that it's important to remember that those folks that are making the diagnosis, it could be one individual that is getting the information and coming to that conclusion with you, or it could be done as part of a team evaluation. And that team might include other folks like the people on this hub team, speech language specialists, occupational therapists, social workers, navigators, and those individuals are contributing to the collection of information to help the clinician make that final determination. Next slide. So when you're heading in for an autism evaluation, the goal is really for that person that's meeting your child or family member to determine if autism characteristics are present. And to do that, they're often going to have some time that they're just interviewing you as the caregiver, or interacting with your child. And they're looking for features of autism. They're looking for other behavioral symptoms that might be part of the autism or a different diagnosis. And they're looking for some of those medical things. So the case today talked about eating. Somebody mentioned sleep. So some of those things that we know can sometimes be challenging for people on the spectrum. There is going to be a degree of observation of the child or of the patient that's being evaluated. And there may be some developmental testing or collection of developmental information to get a sense of developmentally, what should we be expecting from this person? Sometimes there's even play-based testing. So there are some diagnostic tools that include playing with a very specific set of toys, and that can provide additional information about how the child interacts socially and communicates. And then an evaluation to assess a child for autism should always include some opportunity for that person to sit down with the family, with the caregiver, and discuss the diagnosis and any recommendations that they want to make. Next slide. So there's lots of different types of tests or rating forms that might be used. There's documents that are designed mostly for screening for autism concerns. So in young children, we use the MCHAT. In slightly older children, we'll use something called the SCQ or the SRS. So these are just rating forms that parents are completing that are answering questions about the way they see their child, in the way their child interacts, plays, communicates. And then there are some behavioral observations that are completed by the autism specialist or by the clinician. And those are designed for that person to gather additional information beyond what the parents are reporting in those screening tools. All of these assessments are designed to answer questions about symptoms that are listed in what's called the DSM-5. So this is a list of symptoms, criteria that allow clinicians to determine if someone has a particular developmental or behavioral health diagnosis. So really it's the DSM symptoms and the presence of them that allow a clinician to make that decision. And these other tools just give that clinician more information to make that choice. Next slide. You know, it is important to think about, you know, what your particular school district, your state, your insurance company might require, because that can differ. That can differ from state to state, from county to county, district to district, insurance to insurance. And so it is helpful as a parent or a family member, if you know your insurance is going to require this particular documentation, or your school district has said, we need to see this. It's helpful to know that requirement and ask about it when you're scheduling the appointment. I will, and this addition of rights law is in here because sometimes school districts and insurance companies will tell you something is required when that might not actually be entirely legal. And so it's important to know what is being required in order to confirm a diagnosis so that your child can access the services that they might need. And it's important to reach out for help if you're finding that your insurance or your school is really giving you a hard time after you've already completed a diagnostic evaluation. Next slide. So then the question, how many visits? How long are the visits going to be? This can differ quite a bit. There are evaluations that might be a single visit. There are others that might be designed to occur over multiple days. Sometimes a visit might be as short as 30 to 60 minutes to get some basic information to get started. Some of those longer visits could be 4 to 6 hours, especially if multiple people are involved. And I think it's really important, you know, there's lots of variability in how we can assess for autism and make that determination. A shorter visit with only one person or a smaller visit is not necessarily less effective. The goal here is quality, not quantity. And having a clinician that really has a good sense of your child, has good information about your child's behavior and their development, and is able to give you a good explanation of how they've reached a decision about a diagnosis based on that information, that's what's important. The diagnosis is based on clinical judgment that is informed by some of those tools that I showed you earlier, but it really is a clinician that knows autism and has a good picture of your child making that determination. That's the most important thing for you. And I will say, as a person that has, you know, specialized in autism for many years now, I am very comfortable with saying if I'm not sure, and if I need to refer a child to another specialist or for additional testing. So it's okay. You may not get an answer in that first evaluation. And that just means that that clinician needs a little more data. And if that's what they're suggesting to you, I know it's not the quick answer that you were hoping, but it means that they're thinking thoughtfully about your child's presentation and making sure that they're getting to the right answer for your family. And then I think it's always important to think about reevaluations, and families will often ask about this. And what I would say is it's not always necessary, right? If a child has autism and they've had a really good evaluation and parents understand this diagnosis and understand what they need to do next, there's not necessarily a need to reevaluate to see if the autism is still there. But it can be helpful to reevaluate other specific skills. So speech language evaluations, fine motor evaluations, learning evaluations, those need to be repeated because children are going to change and skills are going to change. There may be times that additional data or additional questions might pop up. So things like, does the child have another diagnosis like intellectual disability? Is this an individual that needs to have some special evaluations to determine things like independent living and employment? Those are all really important reevaluations that do need to happen at some points, you know, in a child's life. But the autism evaluation really should only be reevaluated if there's now a question about that diagnosis again. If a child has new symptoms that are presenting that don't line up with autism anymore, that's when we would think about reevaluating. I think this is the last slide for me, so I'm going to hand it over to Monica.
And Judy, I think you wanted to answer the question in the chat.
Sure. There's a question about televisits, and I was going to type this, but it'll be faster to say it. Telehealth visits can be a great way to observe kids with autism and see them in their own home. So that can be terrific. Sometimes maybe the child is really uncomfortable and doesn't want to participate, or they really do well in Zoom meetings and it's not really how they look when they're in real life. But the good clinician will ask the parent and say, am I getting a good picture of this kid today? Just like they would if you were in the session in person. The clinician will always ask, is your child acting the way that's typical for them? Am I getting a good sample? So telehealth or in person, both can be good. Both should have some question about, am I getting a good sample of this kid? All right, Monica, I think this is you. You might be muted.
Monica, I was going to say, Monica looks a little bit frozen.
It's kind of thing from parent perspective is really, can you hear me?
Okay.
Hello?
Let's try now. You were frozen, but let's see.
Okay.
Yeah.
Am I back?
You're back.
Okay. Sorry about that. So what to bring the day of the assessment? As a parent, it can be a very overwhelming and stressful day. I think even before when you're thinking about what to bring, it's how are you going to get there? Are you driving in? Are you taking the train? Are walking? What time should you get there? You want to try to make the day as stress-free as you can, because it is going to be overwhelming, not only for you, but your child as well. And I don't know about you, but my children definitely feed off the way I'm acting, right? So sometimes I need to calm myself down if I want them to calm down. So just kind of think of how you're going to get there. I like to give myself 10, 15 minutes of extra time, count traffic, etc. I'll be the first to admit, though, that sometimes that means I'm running in right at the start time because there's traffic I wasn't expecting. So just kind of be prepared for that. A support person. So who are you bringing? Can you guys hear me?
Not really.
You're breaking up a little bit.
Okay.
Sometimes it helps, Monica, to turn your video off. I don't know if you want to try that so that your audio will be better.
Okay. Is that any better?
You're good now.
That's
okay.
Better.
So again, it's going to be a stressful day, potentially a long day. If you can bring your partner, a support person, whether that be a family or a friend to help you out throughout the day. Also think about bringing care for siblings so you can focus on the meeting. As Amanda discussed, you're going to be filling out a lot of different surveys, questionnaires, and that can just be daunting a little bit, right? They're asking you questions about your child, and sometimes they're not posed in the most positive way. So you want to be able to walk away, give yourself a break, walk out of the room, get a drink of water, come back in, and be able to support yourself and your child. Second point would be to dress comfortably. You might be there for a while. I know in our session we were playing on the floor for a little bit, so you want to dress you and your child comfortably to best support yourselves throughout the day. And just like when we're going out and about, we want to bring extra diapers, change of clothes, snacks, sippy cups, water, all of the things you would do if you went out to the park that day. You want to kind of pack. Preferred items are a great comfort item for your child. I know when my son was little, his comfort item was a plastic banana, and we brought that everywhere for a long time. So anything that works for you that will just make this day a little bit easier on them. Medical records, you want to bring anything that will, from the school, your pediatrician that will support the clinicians that are doing the assessment that day for you. And as Amy discussed earlier, your concerns and observation, that notebook would come in handy here. Hey, I noticed he's, when an airplane flies by, he's not pointing at it. How is your child interacting in a room of peers? What does that look like? And just kind of knowing what you want to address going into it will help. And if you have that written down, that really makes a big difference, because during that day, like I said, you're kind of being pulled in a couple different directions. So if you don't have it written down, it's easy to forget. I know something I do is I just keep in notes in my on my iPhone of things, and I still do that to this day. And my son was diagnosed 6 years ago. So just kind of keep yourself a running tab of things that you want to discuss and concerns you might have. The other thing is, just to bring up before we go to the next slide, is think about how long you might have to wait to get to that appointment. So ideally, you go in for your assessment, you're the first appointment of the day, you arrive at 9 o'clock in the morning, and you are, you go right in the room. Well, that doesn't necessarily already happen. Just like any appointment for us, you might be delayed a little bit. So how can you prepare your child for that? We always bring some preferred toys, stickers, drawing pads, etc., an iPad, making sure that they're ready, that they have some support items while they're waiting. And the other thing to consider too is, does your child have any triggers? So something weird about my son is that he doesn't like to watch Thomas and Friends, the show. He's obsessed with it. The characters, he likes the YouTube videos, but he won't watch the show. So when I have an appointment and I know we're going to be waiting, I always reach out to the scheduler and say, hey, are you going to have PBS on in there? Or is it a Disney channel? You know what I mean? What kind of shows are on that TV? And if, because that's the first thing he's going to look for, right? And you don't want to trigger him as soon as he gets into the room. We ask for sometimes the TV to be off, depending on the relationship we have with the schedulers. It's just something to consider. Next slide. Okay, and what's your role in the assessment? So you want to come prepared with information, assessments, and questions. They're going to ask you about your family's history. Are there any other developmental disabilities within the family? What did the birth look like for your child? You're going to be answering those written questionnaires and assessment from your perspective as well. And I think the most important thing is you want to support and advocate your child throughout the assessment. You want to speak up. Are they acting typical? Is the behaviors that you're seeing something that you're not used to seeing at home? Or is this, does this assessment resemble a typical day for your child? Next slide. And takeaways. So you are an equal and critical member of this assessment team. You are with your child every day and know them best. Sometimes it's even the role that you'll play is helping facilitate your child to participate in an activity, right? So if they want them to sit at a table to do a puzzle, right? And you know your child is better sitting on the floor, you want to vocalize that, right? To help get the best out of your child as well. And then in that regard too, as I said before, the assessment day is just one snapshot in time. You're not going to see all the behaviors. Taking those notes is really important there. And you want to ask questions. There's no stupid questions. I wish I knew that when my child was 3 and we were kind of walking through this. It's good. It's a totally different world that you're entering, and acronyms that are used and the type of different therapies that are offered are new to a lot of people. And it's important to ask any questions that you have. And then also you want to allow space for your emotions. It's a stressful day, and it can be overwhelming. I don't think I was prepared going into our evaluation for the emotions I would have after it. So when you are done for the day, giving yourself a couple minutes to just breathe, take a walk around the block, talk on the phone with a good friend. But just being able to kind of sit with those emotions and know that that's okay. It doesn't, you're not thinking any of, your child isn't going to change based on the diagnosis that they may or may not get at the end of this. They're still the perfect little boy or girl that you had the day before. And you need to kind of keep that in mind, but it is an emotional journey to get an assessment. And that's really important to acknowledge. And then I think the last thing I would say takeaway would be before leaving, know your next steps. Where do we go from here? Am I getting the results in a week? Or do I have another appointment I need to set up? Where do we go from here? You don't want to leave with unknowns. You want to kind of know what's your plan and next steps.